What is an IUD? An IUD, short for Intrauterine Device, is a highly effective method of birth control. The IUD is a small plastic T-shaped device that is inserted by a doctor and left inside a woman's uterus to prevent pregnancy. What are the types of IUDs? There are two types of IUDs available for use, hormonal or copper. The hormonal IUD, such as Mirena, releases a form of the hormone Progestin into the uterus. This type of IUD can remain in place for at least 5 years. The other is a copper IUD and the most commonly used. A copper IUD, such as Paragard, has a copper wire wrapped around the stem of a T-shaped device which releases copper into the uterus. It can stay in place for at least 10 years. How do IUDs work? The hormonal IUD prevents fertilization by killing or damaging sperm while making the mucus in the cervix thick and sticky so that the sperm cannot get through to the uterus. It also keeps the lining of a woman's uterus thinner, making it a poor place for a fertilized egg to implant and grow. A copper IUD releases copper, which is toxic to sperm and is thought to cause an inflammatory reaction in the uterus, which helps prevent fertilization of the egg. The brief localization inflammation in the uterus that begins about 24 hours after insertion causes a reaction that attracts white blood cells. These white blood cells produce substances that are poisonous or toxic to sperm. How effective are IUDs? IUDs are among the most effective forms of birth control available. Most pregnancies that occur with IUD use happens because it is pushed out of the uterus and is unnoticed by the female. An IUD does not protect against sexually transmitted diseases. How is an IUD inserted? You can have an IUD inserted by a doctor at any time, as long as you're not pregnant, and it should only take a few minutes. The IUD is put into a long, slender plastic tube and then placed into the vagina where the doctor will guide it into the uterus. It is then pushed out of the plastic tube into the uterus where it springs open and into place. A plastic string that is tied to the end of it will hang down through the cervix into the vagina. This string is used to check that your IUD is in place and is also used for the removal. You may want to see your doctor in about 4 to 6 weeks after it is inserted to make sure it is still in place. You may experience mild to moderate cramping during and following the procedure, but it typically does not last long. What are some of the benefits of using an IUD? Well, to start, it's easy to use and 99% effective. Once it's in its place, you do not have to do anything else to prevent pregnancy. It does not interfere with daily activities or sex, and you can continue to use tampons. It's easily reversible. Simply have your IUD removed if you wish to become pregnant. What are the possible side effects of using an IUD? Common side effects include irregular bleeding, heavier bleeding, cramping, headaches, nausea, and breast tenderness. For some women, menstrual bleeding completely stops within 2 years of use. Are there any risks associated with IUD use? Serious complications are rare. However, some women have experienced problems such as the IUD coming out of the uterus and moving into the vagina. There is also a greater risk of pelvic inflammatory disease, which is an infection of the uterus and fallopian tubes. IUDs are only available by prescription. A pelvic exam is required and it must be properly inserted by a healthcare professional. IUDs are not right for every woman. Please call one of our highly trained staff members at Professional Gynecological Services today to make an appointment and find out if the IUD is right for you.